am Dr. Laura Padilla, and I'm a medical physicist.
And I'm Benjamin Smith, a radiation therapist.
Today, we will give you an overview of the treatment room, the linear accelerator, and some of its components. Behind me, you can see a linear accelerator. This one in particular is a variant TrueBeam. The accelerator at your facility may look slightly different, but they all have the same general parts. This is the gantry. These two arms are the KV arms, and the panel that you see at the bottom, that's the MV imager. And this is the treatment couch or table.
The next thing we want to discuss is the treatment table. It has several components that can move using this pendant. I can move vertically down or up, in, out, as well as left and right. Another thing I can do is rotate, coming towards you. This way. Bye. Now, if you want to do not turn it off yet. I'm not done. We want to get the patient into the position, so we're going to raise the table and move it up to get him treated, just like so. The next thing we want to discuss is the gantry itself. It has the capability of rotating as well, which I will demonstrate. The collimator that we want to discuss next is inside. It can independently rotate as well in either direction.
Within the gantry, we have a couple of components that help us shape the fields. The first one are the jaws, which you can see in the shot. They allow us to create field shapes that are square or rectangular. The field light demonstrates one of these shapes. The second component are the MLC, which means multi-leaf collimator. The individual leaves help us create field shapes that are more complex. Here you can see how the MLC created a circular shape. As you can see here, we have a phantom. We are now going to go through how patients get set up at the machine. During simulation, therapists place tattoo marks on the patient's skin in order to make their setup at the treatment machine easier. These marks are then aligned with the laser that you can see in green. And we use that to approximately set up the patient to the right position. And then we go on to internal imaging. As we mentioned earlier, there are different imaging panels attached to the LINAC. The first one that I will move is the MV imager. This port image shows you the aperture of the MLC. It shows you what the field shape is. You can only do this with MV ports. As you can see, however, there's not a lot of anatomy to go by, and this is common when your field sizes are small and you're taking MV images especially. But all of the review software allows you to swap back and forth between the image that you just took and your reference image in order to check the anatomical alignment. In this case, you will need to have more anatomy to properly verify the patient's position. When you take MV ports, you have the option to take a planned field port or an open exposure. It is very useful to take an open exposure, especially if your field is not very large, because it gives you a better sense of the patient's position because you have more anatomy to evaluate it by. So in this case, you can see that clearly the patient is misaligned with respect to the reference image. This is where our patient currently is. This is what the treatment position should be. Now we're gonna move the KV imaging arms to position. On the left, you can see the KV source. On the right, you see the KV imaging panel. These images show bony structures more clearly. As you can see a lot more detail and there's a lot more contrast, and we can use them to align the patient. So in this case, we would align the two images to make sure that the anatomy that we're seeing and the anatomy that we captured during simulation for treatment planning match. All the images we have seen up until now have been planar images. The MV ports allowed us to see the field shape because we were taking the image with the treatment beam. The KV images allowed us to see the bony structure a lot better. However, neither one of those images were clearly showing us what the soft tissue looks like. This is what cone beam CT is very useful for, to see soft tissue and to get a volumetric image of the patient that you can then compare to the planning CT. We are now reviewing the volumetric images that we acquired with the cone beam CT. As you can see, you can scroll through the axial view, which is this one, or the coronal view, and finally the sagittal view. You can compare the cone beam CT to the planning CT. You can see that the field of view is different and the image quality is also different. In this cut, you can see that the patient has a pitch that is a rotation that is equivalent to the patient nodding his or her head yes. In this view, you can see that the patient has a different rotation. This is a roll, which is the equivalent of the patient moving his or her head back and forth, saying no. And the last rotation would be a yaw. That's not a rotation that we can see on this image, however. Just to reiterate the translational and rotational names when you're talking about patient position, I am going to go through it one more time. So the up and down is the vert, the in and out is the sup inf, and lateral is just lateral. For the rotations, this rotation is a roll, this rotation is a pitch, and this rotation is a yaw.